let's talk perimenopause, or as I like to say, what? Menopause means around menopause. It is the time during which your body makes the natural transition into menopause and signifies the end of our reproductive years when the ovaries gradually begin to make less estrogen. It lasts until menopause when the ovaries stop functioning and releasing eggs. As we get closer to menopause, the rate of estrogen decline increases. It usually starts around your 40s, but can start in your late 30s or even earlier. The average length is about 4 years, but some women may experience this for only a few months. Others may experience this for as long as 10 years. Perimenopause is said to have ended when a woman has gone 12 months without having a period, and this is what we call menopause. Our menstrual cycle relies on a delicate balance between a number of hormones, primarily estrogen and progesterone, with estrogen being the main female hormone. During perimenopause, the level of estrogen in the body rises and falls unevenly, causing abnormalities in the menstrual cycle. Hi, I'm Dr. Tanya Beaubrun, and I am the founder of Satya, providing programs, coaching, workshops, and retreats. Using an integrative approach to medicine, we help our clients get on the path of being, feeling, looking, and doing well in their lives. In this video, I will share with you the symptoms of perimenopause and how to bloom and experience joy during this transitional stage in our lives as women. You may be experiencing perimenopause if you are a woman in your 40s or even late 30s and have some of the following symptoms: irregular periods, heavy periods, hot flashes, worsening of your PMS symptoms, breast swelling or tenderness, mood swings or irritability, fatigue, insomnia, pain and discomfort during sex, problems with fertility, and loss of bone density and muscle strength. These symptoms can feel uncomfortable and overwhelming, but you can bloom and manage these symptoms by making certain lifestyle modifications. And these include diet and nutritional support. At Satya, we usually encourage our clients to control their intake of sugar and simple carbohydrates in an effort to balance their blood sugars, and also to avoid insulin resistance, which is where the peripheral tissues, including muscle and fat, become less sensitive to insulin levels. This can lead to a reduction in the uptake of glucose by the cells in the body, resulting in elevated blood glucose levels. Excess sugar in the body is converted to fat, especially visceral fat, which is the fat that surrounds the internal organs in the body. And this has been linked to an increased risk of obesity, heart disease, and even autoimmune disorders. It is important to have a balanced intake of protein, fat, and complex carbohydrates. And remember, fat is your friend because it is needed for the adequate functioning of our brain cells. Monitor your caffeine intake as well, because this can affect your response to stress and also your sleep. Get adequate amounts of water and fiber in your diet. Exercise regularly. Make exercise a priority. Manage your stress or your reaction to the stressors in your life. Your adrenal glands will thank you and work better too. Meditation, deep breathing exercises, prayer, and journaling are some ways you can use to manage your stress. Get adequate sleep. Adopt a regular sleep routine. And this includes shutting off your TV, smartphones, tablets about an hour before bedtime and keeping your bedroom dark and cool. This will help stimulate melatonin production and promote deep restorative sleep, and can also help with the reduction in hot flashes. Reduce your exposure to environmental toxins in plastics, cigarette smoke, skincare products, cosmetics. These may contain xenoestrogens, which act as a false estrogen in the body. When xenoestrogens enter the body, they increase the total amount of estrogen. These are not biodegradable, so they are stored in our fat cells. This buildup of xenoestrogens have been indicated in many conditions, including breast cancer, obesity, infertility, endometriosis, and even diabetes. The perimenopause phase does not have to be a rocky road if you accept and not try to fight the process. It is a normal transition time that nature has designed to allow us to step into our purpose and our power. I invite you to download the free PDF to learn more about the 3 pillars to joy so that you can create optimal wellness and ultimate success in your life.